All right.
All right. Good morning, everyone. And as Jackie said, we welcome you to the 2026 Annual General Meeting for the Saskatchewan College of Paramedics. Next slide, please. Thank you. I would like to begin by acknowledging that we are on traditional lands referred to as Treaty 4 territory, and that the city of Regina is located on Treaty 4. The original lands of the Cree, Ojibwe, Saulteaux, Dakota, Nakota, Lakota, and the homeland of the Métis Nation. This photo is of the Grasslands National Park, situated on Treaty 4. The park has thousands of archaeological area that is one of the largest concentrations of pre-contact cultural resources in Canada. We respect and honor the treaties that were made on all territories. We acknowledge the harms and the mistakes of the past, and we are committed to move forward in partnership with Indigenous nations in the spirit of reconciliation and collaboration. Well, good morning, everyone, and it's great to see so many of you here with us today. Welcome, members and colleagues, to the Saskatchewan College of Paramedics 2026 Annual General Meeting. As I come to my final term as President of Council, I do so with a sincere sense of gratitude. It has been a privilege to serve in this role and to work alongside a dedicated council and an exceptional college team. Seeing firsthand the care, the thought, and the effort that goes into this work is something I'm truly proud to have been a part of. I'd like to recognize those who serve on council and committees. Much of this work happens behind the scenes and is on a volunteer basis. It takes time, energy, and willingness to step forward, not because you must, but because you care. That commitment is what helps keep our college strong. Paramedicine has evolved rapidly and encompasses many roles. It includes those working on the front lines in ground and air, as well as those in leadership roles, those supporting communities, working in many areas of hospitals and facilities, in management, mentorship, education, research, quality assurance, and beyond. While these roles may look different, they are all connected by a shared purpose of pride of the profession. At its core, paramedicine is about helping people. It's what brings many of us into this profession and what keeps many of us here. It also reflects the strength and the value paramedics and EMRs bring into the healthcare system. Over time, that purpose becomes a responsibility to our patients and to the profession itself. The trust the public places in us depends on that, and it's something we all share in protecting. Thank you for the privilege as serving as your president. It has meant a great deal to me. I'm proud of the work that we have done together, and I'm confident in the strength and the future of paramedicine in Saskatchewan.
Thanks very much, Noelle. I'm just going to pause here for a minute. I noticed that that a couple of people have raised their hands, and Colette, I'm hoping that you're monitoring that situation.
I'm not seeing any raised hands, but I am watching the chat and the Q&A. If any people have technical issues, they can put them in the chat, and the Q&A will be for later when we are doing the questions portion.
Awesome.
Okay, I do see one hand up now.
Okay.
We don't have voice or video enabled for participants, so I don't know if you can put your questions in the chat real quick and we can deal with them then.
I'll just give you folks a couple of minutes just to add any questions you might have. And while you're doing that, I'll just explain the process. So as Colette mentioned, we welcome your questions and feel free to pop them into the Q&A. We can answer them as we go along. We also will have a portion of the agenda where we invite you to bring forward any inquiries that you might have. Otherwise, technical support, just pop it in the chat. The Q&A will remain for questions. Okay.
So Colette, I'm actually getting a couple text messages here saying that the chat box is disabled.
Oh, okay.
Okay. All right. I guess, yeah, you can put them in the Q&A. I'll see them Sorry about that. I don't have any capability to, actually just hang on a second. Attendees can chat with hosts and panelists. Okay, I have changed that setting, so you should be able to,
Aha,
it'll just go.
David just said it's fixed.
All right, good
Okay.
job, team. Thanks.
Thanks. Despite what we think we know, there's lots of things that I have no clue about. So thanks very much, everybody. So the next few slides will be my slides, and I'm just going to kind of refresh you about the things we've done this year and about really what our overarching mission and vision are for paramedicine in the province. So as you're well aware, the mandate of the college is to protect and serve the public interest. And we do that through regulatory oversight. Our approach to regulation has, for the last good number of years, has been right touch regulation, which basically aligns with using an appropriate amount of regulation for the issue or concern at hand. So it's never our intent to be heavy-handed. And so we've implemented a number of policies or committees or activities within the college to ensure that we're using that right touch approach. And that's why you'll see from time to time we'll modify policies, because we've determined that whatever it is that we had established is no longer appropriate or aligning with the corporate values and the mission and vision that we espouse. So obviously and naturally, our primary responsibility, our sole responsibility, is to protect the interests of the public. So everything we do is public leaning, but that doesn't necessarily mean that we can't and don't lean in your direction. And you'll see that as we go on. I'll bring your awareness to a few things that we've been doing over the last year in the hope that we can continue to support your own health and well-being. So creating partnerships is a big part of why the college is successful and why we've been able to expand and grow in terms of our research capacity and in terms of our ability to offer services to the public and to our members. We align everything we do with a sense of fairness, transparency, collaboration, and professionalism. And as you've probably heard many times, sometimes fairness is not equal. So we try and provide the level of support that individuals need based on what their unique circumstances are. In terms of what we've been up to this last year, we've had a number of key areas of success. These are by no means all of them, but they are the primary ones that I wanted to just highlight for you. Our first committee highlight is the new Fit for Purpose Committee. This is a very substantial initiative that we started working on more than a year ago. That committee, the intent of that committee is to support and assist members who are struggling with physical, emotional, any kind of limitations that are impacting their ability to practice effectively. And so the concerns that might come in that would be referred to this committee would typically be concerns around an individual's health and well-being. And so the process that we would follow, rather than following a professional conduct process where it results in some form of a disciplinary or behavioral contract, we moved to a fit for purpose mandate. And the fit for purpose, really what it does is we work with the individual to identify what limitations they might have and what supports they need in order to return to practice in a safe and healthy way. We have experts on our committee that have backgrounds in both paramedicine, but also in the social sciences like psychology and in disability claim management. So we want to make sure that we're looking at the whole person and not just the individual activity that raised the concern with the college. In addition to the Fit for Purpose Committee, we revised clinical practice standards over the last year. You will be well familiar by now with the Canadian Paramedic Competency Framework. That's a mouthful. And that framework was developed by the Canadian Organization of Paramedic Regulators, so COPR. And what COPR did was worked with all of the jurisdictions that are members, which is almost every jurisdiction in the country. And we established a framework for competencies. And from there, we established entry to practice competencies, which is why some of the program changes that are currently underway have emerged. We also updated our professional code of conduct, and that was specifically to ensure that the code represented measurable terms. It's very difficult for us to ask people to adhere to a code of conduct if you can't measure what success looks like. So we updated that. There were a number of scope of practice changes, as you're well aware. And we revised EMR program standards. The EMR program standards were a very significant change, and a lot of that was driven by system need to look at the quality and the scope of practice for emergency medical responders, but also because nationally we were lagging behind pretty much every jurisdiction in terms of education, education duration, clinical practice. So the new standards are really drove out some need to expand the training program. So it's longer, there's additional scope, and an updated examination, as well as a clinical portion of the training. There will be gap training requirements for individuals who are currently EMRs who wish to take on that expanded scope. And some of that gap training has already been approved and is on our website. So if you have questions, you can certainly contact the college. We worked on some business continuity updates because we wanted to ensure that we were staying current with the changing environment. And most recently, we launched a request for proposals to examine whether or not our system could be updated or improved. And we did that for a number of reasons, but not the least of which is that we have changing needs within the college. We'd like to look at what, if anything, AI can do for us. And we'd also like to streamline some of the financial aspects of our registry system. So stay tuned. We'll be updating everybody on that as the year progresses. The Regulated Health Professions Act was also updated, although it hasn't been officially launched for us. Sorry, bear with me here. The RHPA is what we also call umbrella legislation. And as you may recall, the provincial government is moving towards putting all of the health regulators under the same type of legislation so that we have a common thread that runs through all of them. Most recently, the province determined that the rollout of this legislation is going to take a bit longer than they anticipated. So the first couple of colleges to roll out will be the physicians and the nurses, all of the nursing colleges, and those will be rolled out over the next 3 to 4 years, and then other colleges will follow afterwards. That said, we are actually working with the ministry as our colleagues in regulation to identify the contents of the new regulations that will impact all of us so that we do have input and insight into what's coming in the future and we can prepare ourselves properly. There were PCC process improvements that happened over the last year. We updated supervision standards for new grads awaiting exams, which was in an effort to alleviate some of the concerns that employers had raised with us about having direct supervision or arm's length supervision. We introduced wound care standards. We also advanced some of our research and continue to do so, and continue to do this with a balanced budget. Sorry. Okay. So in terms of regulatory administration, I think I've already mentioned all of these things, so I'm just going to keep on going. And I'm going to turn over to Jennifer, who is now going to provide us with an update on the Professional Conduct Committee as well as the Discipline Committee. Over to you, Jen.
Thank you, Jackie. Can you guys still hear me okay?
You bet.
Perfect. Thank you. The Professional Conduct Committee is a council committee which receives its authority through the Paramedics Act. Its role is to investigate all of the complaints that are received by the college. And we're quite fortunate where SCoP's PCC does have some complaint resolution abilities, such as dismissal or the ability to enter into a complaint resolution agreement with our members who may be subject to a complaint. And this really allows us to manage some of our complaints outside of the discipline committee process. The current Professional Conduct Committee currently is comprised of 1 public representative, 8 ACPs, and 2 PCPs. 2 of those members hold the wound enclosure endorsement, and 2 of them also hold the community paramedic endorsement. In 2025, last year, we had a total of 43 complaints that were managed directly by the PCC. 2 concerns that were brought forward were managed through the Fit for Purpose Committee that Jackie mentioned, and then the medication errors were reviewed and managed by the Paramedic Practice Committee. Can we skip to the next slide, please? Some of the stats from last year, you will see that complaints coming from the public were still our #1 source of concerns brought forward. Although in 2025, we did see an increase in peer or colleague complaints, which actually went up quite a bit from 2024. Part of that is kind of indicating to us that there's probably a greater awareness of reporting among members. We did have the standards of practice that came out last year as well, which kind of more clearly defines some of those duty to report requirements. And there's also some increased professional scrutiny just among members as well, kind of highlighting the pride that I think a lot of individuals have in the profession, and some shifts in workplace dynamics as well. Overall, our number of complaints were down about 20% from 2024. So in 2024, we had 53 complaints compared to the 42 total that we received in 2025. Also, while the number of complaints is going down, which is a great trend to see, we have noticed that the complexity of the complaints has increased somewhat significantly. So some of these investigations are taking a little bit of time, but the PCC does continue to manage all of the investigations in a fairly timely manner. The vast majority of complaints are resolved within the 4-month period. So that's quite good to see. From our complaints last year, 16 related to professional incompetence, 22 were related to misconduct. So misconduct would be issues relating to breaches of the code of conduct or possibly standards of practice. And 3 were kind of a combination of incompetence and misconduct. The majority, again, are managed through, the PCC was able to manage the majority of complaints through dismissal or through that letter of caution, with complaint resolution agreements also being a source of management for a significant portion. All the decisions from the PCC on how they manage these complaints are based on the evidence found during the investigation and on the severity of the complaint itself. Next slide, please. So the discipline committee performs hearings when a complaint is referred to them from the professional conduct committee. The discipline committee is an administrative tribunal process, which is a process similar to their courts and their processes. They conduct hearings, review the evidence, and then make binding decisions. They are not part of the court system, and they focus on issues regarding specifically professional misconduct or incompetence only. Our discipline committee right now is comprised of 2 public representatives, 5 ACPs and 2 PCPs again. 1 holds the wound closure endorsement and 1 holds the community paramedic endorsement. In 2025, we did have 3 discipline hearings. All 3 were originating complaints from 2024. which were just the hearings themselves were just finalized in this year. And that's all for me.
All righty. Okay, here we go. So just in terms of numbers, what we have seen over the last year is an increase in our numbers, which is fantastic. Currently, we have 2,200, just over 2,200 practicing members and 173 non-practicing members. So we have about a 5% non-practicing, which is a drop for sure. But with the increase in practicing, that's a really positive sign for us. With a total of about 2,400 members, which is probably, if not the most we've had since the inception of the college, it's pretty close. You'll see that the numbers here are slight changes. Sorry, I'm going to drag this out of the way. Forgive me. You'll see that we have one more critical care paramedic, which is always good. We have a number of advanced care paramedics, so folks that have advanced their PCP to the ACP level. We had a drop in intermediate care paramedics and a significant increase actually in the primary care paramedics, as well as the emergency medical responders. And some of that may be driven by the fact that the program was changing and that people identified a need to get licensed before the program changed. The community paramedics have also had a 15% increase, which is the endorsed community paramedics, which really is fantastic. We're super happy to see that. And labor mobility, of course, also contributed significantly to our overall membership numbers. So in terms of labor mobility, this last year, we had 134 people come from Alberta. We had 17 come from BC, 14 from Manitoba, a couple from New Brunswick, 7 from Nova Scotia, a couple from Northwest Territories, and a couple from Newfoundland. Ontario gave us 8, and Quebec gave us 1, and 5 others came from other locations, could be out of the country. So generally speaking, the labor mobility is a very substantial contributor to our membership numbers. In some cases, people labor mobility to the province for purposes of exam eligibility and things like that, but that isn't really the norm. And these numbers seem to be fairly stable. So we're really pleased with the labor mobility piece, and we continue to support labor mobility in whatever ways we can. With the changes to the competency profile, there are naturally some gaps that have been identified, so additional training requirements and things like that. But we're trying to streamline and standardize across the country so that labor mobility becomes seamless. And that's obviously the goal of the province, to ensure that it becomes seamless. So the next piece, and I don't believe, Colette, can you let me know if we have our presenter for this resolution?
We do. I saw him he's in the list here, so
okay.
I can give him speaking privileges.
Yes, please. So good morning, Brett. Brett has sent us a resolution, and I'll just let you speak to that, Brett. You can turn your camera on if you're comfortable doing so.
I just promoted him as panelist too, so he should have that capability now. Or I tried to. But the audio will work. Okay, yeah. Brett, if you do want to just speak with your microphone, you should be able to unmute yourself. Um, and the resolution was sent out yesterday as part of the agenda, if you don't happen to have that handy.
I have it on the next screen.
Okay, perfect.
Oh, Brett, I feel bad. I think you're not having much luck here. If you're comfortable, I can go forward and introduce the resolution. If you could just either put something in the chat or a thumbs up.
Yeah, if you want to communicate with us directly through the chat, it'll just go to the hosts and panelists, which is us.
And the rest of you can just chat amongst yourself for now. Sorry about this. I'm not seeing anything come through. So I think I'm just going to continue. My apologies, Brett, if there were technical issues that we simply could not resolve. So Brett has come forward with a really interesting resolution. He had proposed a review, and forgive me, I will move this off the screen. Okay, so the resolution proposed was that the college undertake a review of the hours of work, on-call practices, and fatigue risk in paramedic practice. So I'll just read it through and then invite any questions you might have. Whereas paramedics in Saskatchewan, particularly in rural and mixed service models, commonly work extended hours, prolonged periods of on-call coverage, and variable scheduling patterns that may not provide adequate opportunity for rest. And whereas extended on-call requirements often result in practitioners being responsible for emergency response for long durations without consistent rest, contributing to fatigue and cognitive fatigue. And whereas fatigue has been identified in healthcare and paramedicine research as a significant factor associated with increased clinical risk, impaired decision-making, and reduced practitioner well-being. And whereas variability in compensation structures, particularly regarding paid versus unpaid on-call hours, may influence practitioner capacity to balance workload, rest, and professional expectations. And whereas the Saskatchewan College of Paramedics has the legislated authority to set and recommend practice guidelines, standards, and expectations that support safe, competent care and practitioner well-being. Therefore, be it resolved that Saskatchewan College of Paramedics conduct a review of hours of work practices, on-call requirements, and fatigue-related risks across Saskatchewan paramedicine services. And be it further resolved, be it further resolved that SCoP explore the development of evidence-informed guidance or best practice recommendations related to safe scheduling, fatigue mitigation, and on-call workload to support safe and sustainable practice, and report findings or proposed steps to the membership at a future AGM. So I'm just going to bring myself back here. Okay, so this is a really important issue as well. Our limitations in this situation are that we cannot regulate and we do not regulate employers. However, we can create guidelines and we can do the research and bring it back. Our ability, though, to impose these guidelines on the employer will be somewhat limited, but we don't disagree that this is a concern, and we are committed to doing our due diligence and doing some research around this issue. We likely will report to you before the next AGM, but I just want to thank Brett for bringing it forward. And if anybody has any questions at this point about this issue, this is not actually a bylaw change. This will be guidelines, so we don't need to be concerned that it has to go through any kind of a ministerial vetting process. It's just basically research and recommendations that the college can put forward. So if there are any questions, please feel free to put them forward, and I'll just give you a moment to consider that.
Okay, yeah, so any questions or comments should go in the Q&A area. The first one we have here is from Krista. She is saying, please help me understand how this resolution on hours of work and on-call practices, etc., are within the role of the College of Paramedics to determine. These are workplace conditions and should be addressed through employer policies / procedures, work standards, and collective bargaining where applicable. SCoP has authority over practice issues, not employment.
Absolutely. And I apologize. You probably just heard me say what I'm going to say again. We recognize that our scope is limited. We do have a responsibility to ensure safe and healthy care delivered to patients. And so if nothing else, we can do the research and the legwork. We can identify best practices. As many of you will be aware, there's a lot of work being done by the Canadian Standards Association in this area. It doesn't mean that an employer has to adopt it. It's just information, and it'll be information provided to the membership, but also to employers. It's not intending to force anybody to do anything in particular. It's information.
All right. The next comment is from Marie, who says, I believe this to be important, but this is something that SCoP should be getting in, or is this something that SCoP should be getting involved, or more so directing the SHA and unions to be dealing with?
Well, I'll just note that we, in no uncertain terms, have no intent to direct anybody to do anything. What we want to do is understand the setting. In our fit for purpose activities, we recognize that some of what is resulting in practitioner disability or limitations is driven by some of their working environment. And we're not pointing fingers, but we recognize that there are some challenges out there and that you're doing your best. However, it's basically, we're doing research on behalf of the membership and the public, because the healthier the member is, the less fatigued the member is, the better care we believe they provide to the public. But we won't be advancing these interests in terms of forcing employers to do anything. We're just doing research to understand the employment environment, and so determine whether the college has any ability to support the membership towards gaining better health, but we will not be imposing anything on the employers. That's it. Sorry, go ahead. Yeah.
No, I was just going to go to the next one. I have disabled the chat here for the moment because people are putting all of their comments in the chat when we'd like them in the Q&A, but I'll enable it later if needed. So Darren is replying saying, this is a subject that can be confronted through your OH&S committee.
Yeah.
I think we're going to get some of the same comments here. Robert is saying fatigue management should be on the caregiver, as they know what their limitations are and should consider this as a patient safety risk management concern. And then Julie is asking, what are possible proposals SCoP thinks might occur?
Okay, so first and foremost, I need to say that when we looked at this particular proposal, we considered what's the risk of not doing something. And the risk of not doing something is that we won't actually know the practice environment. We won't be able to support the members as they return to health. The risk of doing something is that people might feel compelled to follow the guidelines. There will be no discipline we have no authority over employers, but it's information for employers. So the upside of that is that employers may find out something that they're not aware of, which, I'm not suggesting that you're not fully informed. You already have policies in place. And you're right, members have to self-regulate. They have to choose when to take a shift or when not to take a shift. They have choices to make, but maybe the members aren't making the best choices for themselves either. So I don't want to anticipate what this research might look like. The SHA has done really good work in this area, and many employers also have done some work in this area. This is just going to be information for the general membership that you can do with as you see fit, but it's also going to help the college understand the reasons for perhaps some of the challenges we're seeing come across as PCC. Some of them are being blamed on workplace conditions. We can't really do anything about that, but we can guide employers just by providing information, and you can take it or leave it. Thank you.
All right. Jamie says, this is long overdue. For myself, I had worked 23.5 hours last week with minimal sleep and still had to respond to calls. This is not safe. This should be implemented, not suggested to employers. We're not regulated. In Ontario, their medics cannot work past 16 hours without 8 hours off, which reduces burnout, whereas our burnout is too high.
Thanks for that comment. We will provide this information to the ministry as well. And, you know, perhaps they might be able to work with the employers to create some different kinds of supports. But I don't want to speak for them.
And so Bradley is saying, I support this initiative. I hope that your investigative and consultation process involves Alberta, as I believe they have implemented a max hour of 14 hours per day. This was implemented mainly through their OH&S legislation.
Yeah. Okay, thank you. Yes, we will be consulting with all of the provinces that are members of COPPER for sure. And we will also reach out to OH&S. But it really, as I said, we're developing what we call a white paper to basically understand the lay of the land.
We do have another comment that was in the chat, so it's not in the Q&A, but it says, some staff, from Stephen, some staff may schedule themselves at multiple employers for shifts and not consider fatigue. Should that not be classified as professional misconduct that SCoP can regulate?
We can regulate it if that extended work causes implications in terms of patient care. We can't regulate how many hours an individual chooses to work, but if it raises concerns about clinical practice, then we do have some responsibility to regulate that.
And so Brett, who is the one who presented this resolution, is commenting that this is a valid concern and needs to be addressed by the employer as well as the practitioner, but a good starting point to raise awareness.
Yeah.
And yeah, sorry, I don't mean to speak over you.
No, go ahead.
Yeah, Corey is saying, due to the amount of employers, unions, and service delivery models across the province, SCoP could be a good avenue to complete a study and provide a recommendation, recognizing they cannot impose on an employer. I think this is a good idea as a self-regulated profession.
Thanks, Corey. Appreciate that.
And we do have one hand up. I don't know if we are wanting to let too many people speak, but I'll just kind of leave that with Jackie, and I'll move on to the next comment for now in the Q&A area from Robert. Yes, 16-hour work with 8-hour rest for fatigue management should be standard practice, with OH&S possible being something that could guide, and patient safety should also be a priority.
Okay. I see that Rod has his hand up. So Rod, I'll let you chat. Hang on a second. Go ahead, Rod. Oh, we're not hearing you, bud.
His hand up was for a bit, so he might just need a second, but yeah.
If not, feel free to type it into the Q&A.
Can you hear me now?
Yes, thanks, Rod.
Yeah, I'm sorry, I have no idea when my hand is up. I didn't push the button intentionally. I apologize.
Oh, okay. Well, then I'm going to take you off.
Thank you.
Thank you. And let's see. Okay, awesome. All right, if we have no further questions, I'm just going to keep on rolling here.
Okay, we do have one last one here.
Okay.
David is saying the daily max of hours allowed in Alberta is 12, according to Quick Search. But I have heard it was allotted to 16 with travel time. I could be wrong, though.
Okay. Okay. All right. Because we all know that fatigue can be as bad or maybe even worse than being under the influence. So yeah. Okay. I'm going to just keep on going. Now is your opportunity to ask any questions that might come to mind, anything that for council or for the college itself. Give me all of it.
While we're waiting for those, I'll just read another one that came through. Jim is saying, I know some medics are working 144 hours in a row, radio not turned off for 144 hours, hearing every single call when other crews go out, interrupted sleep patterns which lead to exhaustion and could adversely impact patient care. It's easy to say it sits on the caregiver, but we all know that employer pressure will often influence an employee's decision making.
Yeah, thank you for that comment. I appreciate that.
And then somebody's replying saying having pagers would help.
Mm-hmm.
All right, new question from Dalen. Is the ACP and or PCP schooling going to change in duration? If so, when is this going to happen?
I'm going to pass this one over to Jen.
That's not really a SCoP question. That's more so kind of falls to the educator. So Sask Poly or perhaps Medivy. They're always kind of reviewing their program and the content for both of them. There likely will be some changes. I don't know what those are or what the length of the program may change to, because those decisions would come from the school themselves.
Thank you.
All right, Christopher is commenting. I'm just going to ask about something that was brought up last year. Where are we on PCPs and fentanyl?
Jen?
Requires a submission for a change to scope of practice or protocol change. The process for that can be found in the protocol manual. So we would need to receive an evidence-based proposal on that first. That goes to Paramedic Practice Committee. Once it's approved, it goes to College of Physicians and Surgeons for their review and approval. Because we would have to change our Health Canada exemption. That then has to go to the Ministry of Health here in Saskatchewan, who need to support it, and then they develop the revisions to go to Health Canada. So that's kind of the process. I haven't received anything regarding PCPs and narcotics, so there hasn't been any movement on that since last year.
Anybody can submit that, correct?
Yes, yeah. Any changes to scope of practice or to the protocols have to come from the members. The college isn't actually really permitted to create those protocol changes themselves.
Thank you.
All right, next question from Jamie. With WPD no longer holding a contract in Lloydminster and the Sask side of town now being covered by an Alberta-based service, will the issue of dual licensing finally be addressed?
I'm sorry to say, no, not addressed. We actually think it's addressed, but it's not addressed to the satisfaction, obviously, of individuals who have to purchase 2 licenses. It has a lot to do with legislation and to do with our ability to regulate individuals within the province of Saskatchewan. If they're not licensed with us, we have no oversight and no ability to regulate. So if practice goes off the rails, we cannot protect the public if they're practicing on the Saskatchewan side. So I'm afraid The long answer is it doesn't really change the fact that people still need dual licensure. Sorry. Whoever thought to put a boundary down the middle of a city should be scolded.
All right. I will go back to the scope of practice part of things. Adrian is saying, I have sent this forward to SHA scope of practice in April 2024. I would have thought it would have been forwarded on.
Jen, do you want to respond to that?
I think that's to do with the fentanyl part, yeah.
I would suggest reach that, contact the SHA, whoever you just got talked with last, and follow up with them.
Okay. That's not very comforting, I'm sure, but got to start with who you said.
Unfortunately, our paramedic practice committee hasn't received any proposals relating to PCP scope changes in the last year. So unfortunately, unfortunately, I can't comment on any further than that.
Jen, your microphone is waving in and out. I don't know what's happening there, but stay close.
Sure.
Stay close. Okay. Sorry, Colette, go ahead.
Yeah, no problem. So Jamie is asking, are we able to view previous scope change proposals? I was thinking it may help guide future proposals and understand why certain changes have not been accepted.
We aren't able to share previous proposals, but absolutely you can always reach out to the college, and if there was a proposal that had been previously submitted that hadn't been approved, we can discuss that. It could be, typically it's because of a lack of that evidence-based medicine. Typically that's where proposals have unfortunately not been approved by paramedic practice or CPSS. But definitely if there's something specific that you'd like to discuss, I'd say just reach out to the college and we can have a conversation.
Okay, so Marie has a comment here back to the fatigue part. Sorry to be negative, as I do believe fatigue to be rather concerning, having myself been in the position. Fatigue becomes a problem in the rural areas as they struggle to maintain services. Will this study take EMS in the rural areas into consideration? Can town hall meetings with these service areas be included, considering we talk about patient care and having a service that can provide care within 15 minutes is still better than 45 minutes for the next closest? Fatigue has had studies done for years and years, and we are still not really much further ahead than we were 20 years ago. It still comes down to the caregivers determining what they can and can't do. Everyone is already aware of fatigue.
Thanks, Marie. Yeah, you're right. This is a conversation that's been happening for a lot longer than I've been at the college, for sure. I think that we would do our due diligence in terms of the research that's been done and the standards that have been established. I'm not sure we would have town halls, because my concern would be that if we have town hall sessions, that it would imply that we actually have an ability to move the dial on this. And that ability does not live at the college. It lives with the employers. That said, we invite anybody to send information in, comments, research that they're familiar with. The more evidence that we can accumulate, the better guidelines or recommendations we could make. So I apologize that we probably won't go on a bit of a road show, but I do welcome people to send their information and comments in. And Marie, you're close. You can come in and visit us if you like, and so can others.
Right. And one other comment about the fatigue thing from Fire Chief Paul. Not a question, but agree that SCoP as a governing body should make recommendations regarding fatigue management.
Appreciate that. Thank you.
All right. New topic from Robert. Is there a deadline for all new EMR licensing requirements to be met by for current practicing members?
Jen, I'll let you respond to that.
Right now, there is no deadline for individuals to complete kind of the gap training. That doesn't mean that there may not be a deadline in the future, but right now there isn't a deadline. So people have kind of as much time right now as they would like to take to complete those gap skills training.
Yes. That said, you can't practice those advanced skills until you get that training.
Correct. Yeah.
Yeah.
Okay. So this is the last question that we have in the queue currently. So, we got another one. Yeah. So keep them coming if you've got any questions. From David, who has a question about liability insurance. I have 2 policies with the same provider for Alberta and Sask. Can I not just use the Alberta one?
Well, the challenge is that it may not cover you in Saskatchewan. So believe it or not, we are still working on this. Ideally, we'd like you to be able to have your own carriers and we don't have to worry about it. Part of our limitation includes technology, which is why in our RFP we have some, for our new tech, we have some provisions that would allow us some flexibility. But at the current time, not all insurers will insure people in other jurisdictions. And we go back to making sure that individuals are all covered in the same way. I appreciate the question, and I know it's frustrating to hear that it's not moving. We're bound by some of our own resource limitations, and we're trying to address that first and foremost through our registry system updates. Thank you for the question.
All right. Back to the gap training and EMRs. Would this gap training be endorsements on their EMR license, or how would one know if the gap training has been completed?
I'll take that one, Jackie, I guess.
Yeah.
So right now, all EMRs have a condition on their license that states that they are prohibited from performing those skills. As they complete the training and submit their certificate to us, then that condition comes off. So if you look on the Verify a Member portion of the website, you can search up an EMR. If they have the condition listed or if it's showing, then they have not completed the training yet. And once they've completed the training, that condition is removed. So all EMRs, current and those who are completing the training right now and becoming newly licensed, until we can confirm that they've taken the training for those new skills, we'll have that condition added to their license.
How long does it, Peter is asking, how long does it take to verify and remove those conditions?
As soon as the certificate is submitted to, preferably to myself, but to the office, it's usually done the same day.
Yeah, so they just have to wait until their member profile gets updated.
Yeah.
And Robert is asking, will this show up now or only after the deadline?
There's no deadline, so all EMRs already have the condition added.
All right, new topic.
Oh, sorry, can I just add?
Yeah,
once folks start graduating from the new programs, they will not have those conditions on their license. Go ahead, Colette, sorry.
All right, no problem. All right, Jason is asking, are there any plans on allowing ACPs to obtain their CCP designation and allow them to practice to that scope on the ground without being hired by a flight service? Alberta is starting to do this with their program from University of Calgary /STARS, offering an advanced certificate in critical care.
Jen, I'll let you respond to that one.
So anyone who is licensed as a CCP, there's no employment requirement for that in Saskatchewan. You do not have to work on STARS or Saskatchewan Air Ambulance in order to hold a critical care paramedic license. You just have to complete training through an approved program. Unfortunately, in Canada right now, I believe all of the programs are sort of tied to an employer. We are aware of the STARS program that's partnering with the University of Calgary in Alberta, and are aware of that kind of program. If someone is licensed as a critical care paramedic in Alberta, they will be able to use that license and use labor mobility to come to Saskatchewan as a critical care paramedic. We are looking at, and I don't know when this might happen, but we would be also looking at having that full program approved as an educational institute as well. So yeah, once it's reviewed and it does become approved, it will get posted to the website under approved programs.
Thanks. Okay. A comment from Ron. I feel as well about fatigue. I feel as well fatigue directly is at the root for rural services, as the community is of priority for client care, and this tends to also result in employee retentions with on-call hours that can directly be influenced in fatigue providing care.
Thank you. I appreciate that. I just want to say, the college isn't attempting to find ways to criticize the way employers are operating. We're attempting to provide you with additional information so that you can operate successfully without depleting your human resources. So thanks. Appreciate the comment.
So Cameron is asking, what is the process that Flin Flon EMS completes calls in Saskatchewan? Are they ticketed?
Ticketed.
I think he means registered, yeah.
Okay. So I'm assuming that their calls in Saskatchewan are random, or not random. They're not necessarily ongoing 365 days a year, that they're just transfers. The only time that we require licensure is if it becomes a course of regular service that you're required to provide responses to border communities. Then it becomes a bigger issue around licensing. If the calls are infrequent and just basically ad hoc, then licensing is not required. Jen, did you have anything you wanted to add to that?
Sorry, no, I don't think so. I think you got it.
That's good.
And we've got another, Cameron is following up saying Flin Flon is a border city, and Robert is pointing out Flin Flon EMS covers Creighton and Denair Beach, and those are both on the Sask side.
Yeah. So those folks should be licensed, although it depends on the number of calls again, and if they're just doing transfers to the Manitoba side, it really is case dependent. So we would need more information to look into that.
All right. Theodore is asking, what is the process for fielding the IFT process? We're seeing lots of communities that are left without service because of blatant abuse of EMS resources, particularly ALS, being sent out of communities and leaving them without any services at all.
Do you know what IFT? I'm sorry, excuse my ignorance. What is IFT?
Interfacility transfers.
Oh, everybody speaks in code, man. I should know that one by now. Thank you. Go ahead, Jen.
That one you might need to speak to your employer. I do believe there are some policies around, especially with ALS, asking for an ALS transfer as opposed to BLS transfer. I'm not familiar with those. Those are kind of, like I said, those are outside of the college. But I would definitely recommend you talk to your employer about that, and they can probably contact the SHA if they're continuing to have issues. Might be something the employer can address themselves with your healthcare facility. They should be able to address that. But if not, then the SHA can probably support them.
Okay, next question is from Jason. Where are we at about bringing our paramedics to full scope of practice based on the NOCPs? I don't feel NOCP-based skills should be solely on the membership to provide proposals, and based on recent initiatives from the government to bring other practitioners to full scope, I feel this is important. Thank you.
I'll start, and then Jen, I'm going to pass it to you. First, I'm going to say that we've moved away from the NOCPs. We're using the Canadian Paramedic Competency Framework. So it doesn't change the scope necessarily, but we aren't actually using the NOCPs as a point of reference. Jen, go ahead.
So we have a few identified sort of gaps between us and some of the other provinces. The government does have, is starting a process themselves to sort of address some of those gaps with various healthcare professions. One of the issues with us is that we have to have our protocols approved by CPSS, which changes our process a little bit. And neither us nor the ministry right now can fully answer how the Ministry of Health's process for addressing these gaps and our current process in the legislation, how those will impact each other, if they will impact each other. So we've got them addressed. We are working on it. I know that that's not a great answer right now, but we are looking at sort of various options of addressing some of those gaps and how we can do it more seamlessly. Again, always practitioners do have the ability to submit for a protocol proposal for changes as well. And so we definitely would like to encourage anybody, to follow that process themselves as well. That's always an available option.
All right, we don't have any more questions in the Q&A right now. We did have one comment about your microphone, Jen, and I know that you're aware that it doesn't completely cut out. It just gets more muffled, and it happens no matter, like, you're not even moving when it happens. So I don't know what it is. So for anybody who, if they're struggling to hear her answers in full, we are recording this meeting, and we will be posting it on our website in the next couple days. So if you wanted to go back and turn the volume up and listen to it in full, I can hear Jen. She does get more muffled, so I'm assuming the recording will capture that a little bit better if it's not coming through on your end. Yeah.
Thank you. Thank you for that.
If someone has a question and they weren't able to hear my answer clearly, they can reach out as well.
Thanks, Jen. Okay, so the next piece is actually a nice break for you. But before we go to break, because the next portion of the meeting is really the business portion of the meeting, I just want to say that I'm incredibly grateful for the contribution of the folks at the college. I will say that Jody Edgeborn and Destin Ash have been responsible for the Fit for Purpose Committee under the umbrella of Jen's authority. And they've done incredible work this last year. I'd also like to say that Louise Durnford, our longest standing employee, has successfully cross-trained Manal Harb, and they flipped positions. So Manal is now our Director of Operations and Deputy Registrar, and Louise is a special advisor, a senior advisor to the college. And also, the contributions of Colette and Jen and Tosin and Rashid can't be understated. the college works well because we've had long-standing employees who are very committed to the purpose of this college. So I just want to make sure that I have a moment just to thank them and thank them for their work for the last year and for the years before that.
All right, so it is 10:23 and we will call the official meeting to order. I would like to now introduce you to our parliamentarian for the day, Marilee, to say a few words about her process and the role that she takes for this.
Oh. Marilee, are you there? I wonder if she stepped away for a minute.
Okay, we can give it another minute here just to see if
we'll give her a few minutes. Paulette, do you mind just popping her an email? Thank you.
Yeah.
I'm unable to see actually the participants, Jackie. Do we have her on?
Yeah, she is on. She's on our main.
Sorry, everybody. Sorry, everybody. I just got delayed getting back here. My timer went off a little late.
It's all right.
No problem. Thank you, Marilee. I just wanted to introduce you to the membership and if you could say a couple words about your role.
Okay. Well, again, sorry for being late. I guess we need to update the slide. It's now KC instead of QC. That automatically happens when a sovereign passes away.
Sorry.
But that's no. I kind of like the QC better. But anyway, that has changed.
Yes.
But as many of you will know, I act as legal counsel for the college, and this role of parliamentarian is to assist with procedural issues that might happen during a business meeting. And I think that rarely does occur with this particular organization, which is a testament to you as well. But in case anything should happen, that requires some assistance in terms of the rules of procedure. My job is to provide advice to the chair.
Fabulous.
Thank you so much, Marilee. All right, if I can please get a motion for approval of the 2025 AGM minutes.
You can do that in the Q&A, I guess, or the chat, whichever.
Hey, Darcy McKay is gonna do the motion and David Doucette will second it if we're needing a seconder.
We do. Thank you both, Darcy and David. And any opposed?
So we can do a vote here. Or do we, I have a poll set up to do the official vote.
Okay,
good.
Good.
Sure. That'd be awesome.
Okay. All right, I have launched the poll, so everybody should be able to vote. While we're waiting for these votes, I will say that I'm not sure exactly how the numbers compare to last year, but we had 370 people registered for the meeting this morning. And so far, I've seen the number go up to as high as 325 for attendees.
Okay.
So we've got 318 online right now, which is great to see.
Fantastic.
And I'll just let you let us know when the voting has come to an end, please.
For sure. I'm getting a comment saying not all screens are showing the vote screen. It's in the polls/quizzes area if it's not popping up on your screen. Otherwise, I will say it's a pretty big vote split. So, or I don't know if that's the right term, but we're at 98% saying yes, 180 people here. So.
Okay. The poll section can be found under if you look at the three dots under more on your banner, click there and you'll find polls there. I think. Okay.
And yeah, we have more than 50% of the entire meeting voting yes. So I think we're probably good to go.
Okay.
Thank you, Colette.
All right.
All right, so on to our election results.
Okay. Oh, there's some notes here. Oh, yeah. Sure there are.
All right, well, congratulations to David Copperroot as Vice President. And then I would also like to congratulate John Antall and Ian Brown as members at large.
The total number of eligible voters, I'll just add, we had 2,400 eligible voters, 440 voted, which is about 18%. And we'd just like to thank you for expressing an interest in council and committee work. The committees will be notified in June of successful appointment to committees. And we do that so that the new council can approve the committee postings or the committee appointments. So sorry, Noelle, I jumped in there. But...
No, that's okay. As long as one of us gives a great big thank you to everybody who took the time to vote, I greatly appreciate it. All right, so the 2026-2027 Council of the Saskatchewan College of Paramedics looks as presented.
Okay. I will comment on the fact that we have a TBD on the public representative side. The public reps are appointed by the ministry, as you will recall, and so those processes of appointment are underway. We have Roger Carrier retiring from council this year, and so I think we would all just like to thank him specifically for his contributions to council. He is extremely knowledgeable and has been a really valuable member of council. And I'll pitch it back to you, Noelle, to talk about our departing council members.
All right. Thank you, Jackie. I'd like to express my sincere thank you to both Matt McGurk and Mike Slater, who have both served multiple terms on council and have been active participants on the college, both at the council table and beyond. Your voices and advocacy will be greatly missed, and it's been an honor to work alongside both of you.
Thanks, Noelle. And here's a last opportunity, last opportunity for you to raise anything you'd like to raise.
And again, just type it into the Q&A area and then we can answer them as they come through.
So I don't see anything popping up here.
Okay.
All right. Can I please get a motion to adjourn the meeting?
Okay, we did get two comments. We did also get the motion to adjourn. So I'll just
okay, let's go back to the comments, please.
Yeah. So Robert is saying, thank you, Noelle, for your dedication to SCoP. We appreciate you. Christopher is asking, regarding mental health transfers, why is this put on EMS crews?
Oh, I don't know the answer to that one. I think that's an employer question, I'm afraid. I'm sorry. Good question.
And Christopher is following up his question with, we really have no training in this and it ties up valuable EMS services.
Okay, fair comment.
And that it's a safety and fatigue management issue.
Okay.
Julie is asking if we have to vote regarding the resolution.
No, because the resolution itself is not a bylaw. It really is a resolution for the college to do a bit of work and do some research. So you don't have to.
I'm just going to give it another second or two here to see if there's any more questions or comments.
I'll just remind folks that if they have any questions, they're welcome to send them at any point in time to the college, and we'll be happy to address them. And if they have a broad impact, we sometimes put that information in the pulse.
Okay, and we did get a motion to adjourn from Kathy Chrisman. So thank you, Kathy.
We don't need a seconder.
No. But before we close, I want to again thank everyone for your continued dedication to the profession of paramedicine and for taking the time to be a part of today's AGM. As I finish my term as president, I want to sincerely thank you. Serving in this role has been a great honor, and I'm greatly proud of the work that we've done together. I would also like to formally welcome Bill Fisher as incoming president. Bill brings strong leadership, experience, and a clear commitment to this profession. I have every confidence in his ability to lead the college forward, and I know he will continue to build on the strength of the work already underway. The work that you do matters, and the difference that you make in the lives of others does not go unnoticed. Each of us has a role in leaving this profession stronger than we found it. With that, I will now formally adjourn the 2026 Annual General Meeting of the Saskatchewan College of Paramedics. Thank you again for joining us today, and I wish you all a safe and successful year ahead.
Thank you.
Thank you, everyone.